Welcome to The Holistic Nurse with your host, Peggy Smith. Peggy will introduce and educate her viewers about the differences between alternative, holistic, and complementary medical therapies. Her goal is to empower the lay medical consumer to learn how to advocate for themselves. So now, please welcome the host of The Holistic Nurse, Peggy Smith.
Hi, and welcome to The Holistic Nurse with Peggy Smith. What if your diagnosis is not the problem? And if it's only a label? And what if your body's been telling you a much longer story for a lot longer than you've been aware? Today, we're going to be getting to the root cause of the problem, any medical or psychological problem you might be dealing with. And we're going to hopefully shed some light on the challenges that having a diagnosis can present. I'd like to welcome Dr. Gloria Warren, who is going to be joining us today with her expertise. Welcome, Dr. Gloria. How are you?
Thank you for having me.
So, today's episode might be a little bit foreign or uncomfortable, but it's a very important topic to know before you get yourself immersed in medical care. As nurses, we're trained to identify, name, and treat a problem, a diagnosis. Doctors are pretty much trained the same way, and they have been for years. That's, I guess they say if it works, don't change it, but it hasn't always worked so well. But as nurses, we also see things that sometimes the doctors don't have time in their short visits with you. And that's what I'm going to try to share today, because we see a deeper story that the doctor sometimes, through no fault of his own, is not able to catch on a short initial visit. Today, we're talking about why the diagnosis is not the root cause and how holistic nursing can look beyond the labels and help you understand the full picture so that you're able to participate actively and engage and become a holistically healed person. Uh, we called you patients for years. Now you're consumers of this medical uh, process that we're all part of. I'm going to start off with what exactly a diagnosis is and what it doesn't do. A diagnosis is necessary, but it is not your total identity. It's not even part of your identity. It's a necessary tool that enables and basically justifies insurance reimbursement. And most of us, are bound by the rules of insurance reimbursement. There has to be a logical, across the board, fair to everybody way of reimbursing for tests and treatments that are available. And so non-medical people, the insurance people, came up with the diagnosis codes and labels that help them understand why we ask for so much money for the treatment. It provides a pathway to know which direction to go to hopefully find some answers for you. It's a shared clinical language that the business people, the business model, the doctors, the nurses, the patients, the families that support you, we're all pretty much familiar with diagnoses. In some fields, some of the psychological fields, sometimes you can't get a certain treatment until you failed at other treatments. It's kind of a negative way that medicine has looked at things, but that's one of the purposes that a diagnosis does. But it gives us a snapshot. You go to your doctor, you name some of your symptoms, and they like it if you don't just say, "I just don't feel good when I wake up in the morning." If you can be specific, it's a lot more helpful. Uh, but it describes symptoms that may or may not get to the real diagnosis that allows you to get treatment, but it doesn't tell how the body got to that situation. It doesn't talk usually about the different systems of your body that are dysregulated, what stresses and how they accumulated over time, and what the body has adapted. And as nurses, we've seen patients show up with, they've done everything the doctor tells them to, take every medication, attend, doctor's dream patient, does everything he says, and they still don't feel better. And today, Dr. Gloria, an epidemiologist, is going to help explain exactly some of the effects that are not typically considered in a medical diagnosis, particularly stress, um, and the other things that bring you to the doctor to begin with. And Dr. Gloria, would you like to just
Yeah.
say a little bit about who you are and what your background is?
Oh, hi, I'm Dr.
And
Gloria Warren, and I'm a doctor, a research doctor, as well as a certified epidemiologist, and I'm also a medical intuitive. I have my own show as well. So, anyway, so you were mentioning, the root cause and everything. I think what viewers need to focus on is the diagnosis explains what's happening, but it doesn't always explain why. And that why really gets to the root cause of the problem. I'll give you an instance. If I have a diagnosis, say an immunity disorder, um, they're not telling me why this is happening. So, that's why I believe in self sustainability and research. Go ahead and research yourself and see which area you fall into. Because an immunity disorder can actually be a genetic disposition, it could be chronic inflammation, from infections and gut health, long term stress, and things of that nature, even injuries. It could be gut dysfunction. 70 to 80% of immune system disorders um, are regulated through the gut. So that's a big possibility. Also, environmental and chemical exposures can cause an immunity disorder, like household cleaning chemicals and pesticides, heavy metals, things that we're exposed to on a daily basis. So, just to get the diagnosis, though, of, hey, you have an immunity disorder, I need to know why. So that maybe the doctor doesn't have the time to figure that out, but they're treating the symptoms of your problem. That's good. That's, something that you'll probably need. But at the same time, um, it would really be good for you if you have been diagnosed with anything to go ahead and figure out why this problem exists and what's happening. Where is it coming from? The diagnosis just creates the framework for the doctor and the health care practitioners, the treatment pathway as well, and a shared clinical language. But it's only a snapshot of the story. So we need to figure out, and all medical caregivers should try to figure out the root cause. And if your doctor's not doing that for you, have an open discussion. Everything we say here, basically, you need to seek a medical professional before you take any of our advice, but we're not giving advice. We're just trying to inform you. And to inform you, you need to also inform your physician or your medical professional. And that means taking some of this information and actually finding out more yourself, doing the research, and taking it to your medical professional to inform them. They don't go over 100% of everything. They don't have that kind of time. And they don't know your lives like you know yourself. So, in order for them to adapt to your protocols and everything, they need to know more about you. And you need to help try and get to the root cause of that problem.
I think when we all have we feel kind of hurt when we know the doctor doesn't have time for us. Doctors are actually penalized for spending more than, say, 15 minutes in an initial visit. They'll get less reimbursement from the insurance company. When my doctor told me that, I was horrified because it's so unfair. But my years as an ER nurse, people would come to me with their symptoms, and it's 2 o'clock in the morning, and it's an urgent problem that got them out of bed, and they came to the ER, and I'll say, well, how long have you been having these symptoms? And they say, oh, about 6 months. And so my next question is always, well, what made you come at 2 o'clock in the morning? I was just thinking maybe the ER wouldn't be too busy. Well, you guessed wrong. It's a Friday night and it's an inner city hospital,
We know how Friday nights can be in the ER, right?
and probably a full moon too. But,
Yeah.
and a lot of times the initial ER exam, the doctor's going to maybe run some basic tests, and unless it's an obvious problem that'll show up on a scan, they're going to send you to follow up with your own doctors, your own providers. A lot of patients don't do that. They'll go home and say, well, it must not be important or serious because they would have kept me. Your goal, unless you can't survive outside a hospital is not to try to stay in the hospital. A
Right,
lot of the
right.
time is not devoted towards the actual care for your specific problem. What I've learned though too, we have a negative approach to diagnoses sometimes. If the doctor has a gut feeling that maybe it might be this because of his personal experiences with other patients, he can't just start treating that and act on that because the insurance companies say, well, we're not going to pay for this higher test. You haven't ruled, you might find it's not that serious. Do the cheaper test first. Um, and that's just an unfortunate reality. Most of us cannot afford to pay privately for our care, so we have to follow those rules. Um,
Yeah.
there's it's important though to understand how important your role is as a patient. Uh, Doctors, first of all, really appreciate your honesty and your willingness to be part of the team and get to the answer. Symptoms are just your body saying something's wrong. They don't just happen for no reason at all. And if you've been trying to tell doctors for years about symptoms that you're not getting satisfaction for, and then your relatives are calling you a hypochondriac, I still say until you've ruled out scientifically and medically that there's not a problem, don't give up. Don't just assume that, because Aunt Mary said, stop complaining, offer it up to God or something. There's certain cultures even that think it's you get extra time uh, out of purgatory or something if you suffer on earth.
Goes on
Life
your
doesn't
credit
have
karma card.
so it's really important that you be persistent, you follow your gut. Obviously, if you're in the ER with, uh, maybe nausea and diarrhea, and you're not throwing up blood, something like that, the person that's having chest pain is going to get more attention than you. And that's why it's so important to,
Mhm.
regardless of what an ER, they always tell you follow up with your primary doctor within 7 days, usually is the standard. Uh,
Right.
and there's just so much. It's so important that you participate in this process, uh, because we don't always have. A lot of people go to those urgent cares because they don't have primary doctors. It is harder to get appointments in certain parts of the country in a reasonable amount of time. Uh, Sometimes your insurance company tells you that your doctor you've had for 20 years is no longer covered on your new plan. If that's the only doctor in your state that does this and you can appeal the insurance company's decisions. Their decisions are not final. They bank on most people will not appeal. And if you have a valid reason and you need this treatment. So we're going to take a brief pause right here and talk a little bit more about why symptoms are so important. It's not a failure of your body. We'll be right back.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick. And to help support the Broderick Foundation, please go to easysense.com and learn how, with your help, we can fight these horrific brain disorders. That's easysense.com to learn more and help support the Broderick Foundation.
Hi, welcome back to the Holistic Nurse with Peggy Smith and Dr. Gloria Warren. We're discussing how your diagnosis does not define your identity and how you can get to the root cause, because symptoms and the diagnosis are not always in alignment with the root cause. Symptoms are not an enemy. They're a way that your body communicates to your mind, to, pain, inflammation. Pain can be caused by anxiety. It can be caused by digestive distress. Just you feel so tired you don't want to get out of bed in the morning. You just sometimes it is psychological, but that doesn't make it less important. Psychological is important part of our body, probably one of the most important parts after your heart and brain. Pain has always been decided. They teach us in nursing and medical school. It's the fifth vital sign. We take your pulse, blood pressure, respirations, and then the fifth vital sign is, it's a subjective thing. Usually, we don't have a test to give you to see how bad your pain is. We might take your blood pressure and it's sky high, but it's not truly describing what your pain is, why it's there, where it came from. And holistic nursing understands that it might be nervous system overload that or chronic stress exposure. It's been well documented that stress is one of the leading causes of all kinds of cancers. Unresolved trauma, inflammatory load could be hormonal or genetic, and or it could be the environmental influences. And it's kind of like, say, most of us, if you've attended a viewing or a funeral, and every time you go to a funeral, it reminds you of every other funeral you've ever been to in your whole life. It just seems to be a human characteristic. And your symptoms are similar to that. It's reminding you that something's going on, and something wasn't attended to at the time it needed to be through no fault of your own. So your body compensates as long as it can, but often it takes years of fighting and trying to compensate. And if you listen to your own self-talk, someone will, you mentioned to your friend, "Oh gosh, this pain is killing me." And your friend says, "Well, what do you think it's from?" And you kind of laugh and say, "Oh, it's probably just the stress. My life is crazy." Well, you know what? That's probably an honest statement. And your body just said it to you right to your face, and you blew it off, because
Yeah.
that's what we do. Um, so, Gloria, why don't you talk about,
Well,
how when we treat the diagnosis, what we're missing, and, what options we have?
there's different things for different symptoms, but as you said, they're communication signals pretty much. And they are protective strategies that the body uses when it cannot maintain a balance with normal regulation. So, such as pain. Pain is made so that you limit movement, so you don't injure yourself further. Somebody said to me when my knee was hurting, well, take some ibuprofen. Well, the problem with that is I'm such an active person. If I do that, I'm going to become more active today than I was earlier. And I know I'm going to injure my knee further. So think of it that way. Do you really want to? Pain is telling you something. Maybe you need to give that knee a rest. Maybe you need to ice it. Maybe you need to use heat. Maybe you need to do something else. So limiting movement is very important. It could be signaling tissue damage or nerve compression or inflammation even. Um, Interrupt behavior that may be causing you harm. So there's a purpose for pain, and when it becomes chronic, then it can reflect nervous system hypersensitivity or long-term stress signaling problems. So pain is not a problem, it's a messenger. you know and then, of course, there's other types of symptoms. Peggy, would you like me to go into those?
Yes, please do.
Okay. So like fatigue, when you're tired, energy, your body goes into energy conservation mode. Now, of course, it could be blood sugar levels are too low or something else. So you really need to know your own body. But the body slows you down when you're tired. You conserve energy for organ function. You reduce exposure to stressors and forcing rest when recovery has been postponed too long. It's just like if you're running around like a rabbit and you're juggling all these different tasks. You ever actually ask yourself a question? Have you ever actually wanted to just fall down and go to sleep? That's your body telling you something. That's when it's saying, hey, whether you like it or not, we're going to take a rest. So, adrenal strain can be one of those drivers in that situation. There's also mitochondrial stress and immune system overactivation, very common when you're juggling things. It's the body saying, I cannot keep up. This is too fast of a pace for me to survive. Inflammation, now another thing, it's activates a healing process to the damaged tissue. There's a reason it's there. So when you get an injury, depending on what injury or what level of injury, you may want to use ice. You may not want to use it. All depends. There's so many contributing factors to decide which you do. So I used to take care of athletes, and I was a gymnastics coach, and we had people with broken bones. And, sometimes you put ice, sometimes you didn't. If it was bleeding, sometimes you put ice, sometimes you don't. Just put pressure. There's different things. But inflammation is the body's repair crew, not an enemy. It's tissue damage, perceived threats, from stress sometimes, and immune defenses also. Like when a face swells from an allergic reaction. Chronic inflammation can develop, though, and stress hormones can stay elevated. So it's important to see a medical professional to test cortisol levels and estrogen or other hormones. Okay. Also from toxins, irritants, healing cycles. The threat never ends sometimes, especially when
And
it's
one example I can give you personally, when my husband was nearing the end of his hospice journey, he had to be in a facility because I was still working, and it was a facility up on a hill. The parking lot wasn't very convenient. And for weeks prior to his passing, I was sure that as soon as he was gone, that I was going to have to get a knee replacement. The pain in my knee was just unbearable. And one day, as I'm walking up the ramp to get to the front door of the facility, I was by myself, and I said to myself, I just can't do this another day. I get to his room, and turned out he was actually transitioning, and that was the day he passed.
Mm,
Literally, the moment that he passed, my knee pain disappeared. And
yeah,
so what I realized was all my stress of everything I was going through and taking care of him and, anticipatory grieving, getting ready to lose him, I was putting that stress in my knee because I didn't have time to put it anywhere else or deal with it. And
anxiety protection mode. Yep.
and I was just I laughed because I'm in this field, so I understood what was happening. But a lot of times, you have chronic knee pain and you're afraid of, oh, I'm going to need a knee replacement. I'm not a good candidate for surgery. They told me my heart's not very good. And you get all these what ifs. People don't realize that physical therapy can often prevent surgery or postpone it at least
Mhm.
until a much later date, until you're stronger and healthier. It's amazing. If you have a fecal incontinence problem, there's a physical therapist that specializes in tightening up those muscles so that you're not incontinent and changing your underwear so often. I mean, it's just amazing what they do, and they're not recognized enough as it's not even considered holistic. It's mainstream medicine, but everybody's, oh no, this is serious. I'm not going to go to a physical therapist. And they actually can practice independently without a doctor's supervision because many of them are doctors of physical therapy, and
Mhm.
and they can identify problems just in their physical assessment and know how you cannot injure yourself further.
Yeah.
Another, we're getting to diagnoses, in the psychological field. Very often, I had a child who had some special psychological needs. I knew he needed that they called it a TSS in our state, somebody to go to school to keep him on track, keep him out of trouble, and and be support for him during the day. But I couldn't have that until he actually got. I was told literally, when he gets really bad, starts attacking people, then we can get you that service. Well, why wait until it's so
Mm,
bad? There's some things in our system that have to be, uh, looked at by the right
yeah.
people that can make those changes. But your voice matters in those things, sharing your experiences with politicians, even in a healthy way, that they might enlighten them the problems they don't even know exist that their constituents are dealing with on a daily basis. Uh,
Right.
so you didn't mention too much about the hormones, and how that it is important. She mentioned the ibuprofen. Water is the cheapest medicine there is. We come back to that very often. Um, you have
You
severe
always mention it. I love it.
migraines.
Thank you for the reminder.
Yes, and water is a lot of times medical problems and stress problems are related to just not drinking enough water.
Hmm.
And we need more than the 6 to 8 ounce glasses that Metropolitan Life had on their little wallet card years ago. I had a shaman from South Africa who says, you people in America just don't drink anywhere near the water you should. A lot of migraines, sometimes, yes, you do need medication for migraines. But if your doctor is not willing to prescribe a pill or a magic potion on your first visit, it's because you have things that you can do to help yourself, and he can suggest other things that are more holistic but still traditional medicine. And you don't have to jump right to the medicine right away. Uh, so when we come back, we're going to be talking about why treating the causes can have positive outcomes. And Gloria, I'll let you pick up when we start that. And we'll be right back in a few minutes.
Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Welcome back to this week's edition of The Holistic Nurse with Peggy Smith and Dr. Gloria Warren. We're discussing how healing begins when we know what the root cause is, and that usually doesn't start with a diagnosis. Dr. Gloria, would you like to explain a little bit more why the root cause is important, and probably even more important than the diagnosis, from my perspective?
Well, the root causes, you're not supposed to ignore that or the diagnosis, but if you try to, you can expand on the root causes and expand on the diagnosis by looking at the root cause. All right, well, I'll give you an example. You mentioned hormones and inflammation. Well, if you have a high estrogen level, and I'm sure women have been this, you're going to have a much greater pain level when you menstruate. So high estrogen can create a hyper response towards pain. If you have a high cortisol level, you're going to get more swelling, which can create more pain. But if you have a high progesterone level or a high testosterone level, your body tends to ignore pain. So if you have a bad injury, and I've seen people with a broken ankle, and they just walk around like nothing because their progesterone was high, typical with athletes. But if you have a problem that you're seeing, but you're not feeling the pain, that's a reason to see a medical professional. But if you have a lot of pain but don't know what the problem is, that's a reason to see a medical professional. So diagnosis goes beyond just what a doctor may be able to say. You may need to have some blood tests done, check your hormones and whatnot. And find the root cause of what's happening. So that's expanding beyond it. Instead of just asking, okay, what medication should I take? What protocol am I on? You may want to ask, what other tests can we do to figure out what's causing it? Okay. You also ask what systems are dysregulated. If I have a fatty liver, perhaps at home I could take a mild liver support supplement like milk thistle. So noting the root cause of that problem is really important. Another question is, what patterns keep repeating? What does the patient's history reveal? Maybe if cirrhosis of the liver, maybe they are a heavy alcoholic drinker. Maybe they're not, though. Maybe they have cirrhosis. Maybe they have hepatitis B in their history, or maybe they were exposed to something else that's affecting the liver. So it goes beyond the diagnosis. Everything basically pretty much does. And, self-sustainability, there again, I'm big on that. Find out, figure it out, really investigate yourself.
I think our self-talk and the things that we hear around us growing up, and and just our family environments and everything. One example that came to when you were mentioning, the hormonal and the, women's monthly issues. I can remember, grandmothers often said, oh, it's a woman's curse. And you're a child, you're wondering, well, why am I don't want to be a girl, if I'm going to be cursed. Then I got to college and everybody talked about it as this is your friend. Didn't understand until I had a little more experience. Oh, I know why it's my friend, you know. um, but it shows though how we look at things affect the way we approach it. Um, and with that, like I remember, I've often been told once you're 40, you need bifocals, or you can't see as well. I was literally working in a facility trying to read med labels to give out medication. It was the weekend I turned 40, and I was like, this is insane. This can't be true happening to me. I'm 40 years old today and now I can't read. It was just crazy. And I really believed it was my head. I was just I'm listening to garbage. But on my lunch break, I went and bought some readers at the drugstore. Came back, and at least I could give the meds safely. And I made an appointment for the eye doctor to follow up to see. But we hear things like that. When you're 40, and you
Mhm.
hear if you don't use it, you're going to lose it. Well, that's not always the safest way to look at your body. Um, you have options. And I'm not ever telling anybody. I love my doctor. My primary care doctor is an integrative doctor. More and more doctors are graduating with that focus in their education training. But there's also functional doctors out there that help you get to the root cause by doing blood tests that typically, unfortunately, are not covered by insurance, but they're like micro level tests that can predict what your risk of maybe having a heart attack or things like that. Um, and so there's a lot of people out there that are available, and
Mhm.
AI is improving. It's not going to give you the answers, but it's going to give you some questions and information to talk to the doctor. uh,
Mhm.
because just maybe, it is. Like I remember seeing my doctor years ago, and my hands and ankles were swollen, and she goes, "Well, why are they swollen?" I said, "Gee, it's been that way ever since my hysterectomy." And she says, "That's not related to your hysterectomy." And I said, "Well, it seems like that's when it started. I wasn't paying attention." Turned out I was
Mhm.
actually pre-kidney stones at the time. I learned that later in
Oof.
the year, and that's probably why
Mhm.
my hands and feet were swelling. But even minor things like that, don't just discount it. Everything is there for a reason. It's telling you something. And especially,
Mhm.
we often do it, if we're living a crazy routine in our lives, say, well, it's just my stress. One stress, or maybe you're overweight, you enjoy eating. Okay, nobody's criticizing, you're feeling guilty because the commercials say you should be doing something else. But don't just automatically think that it's just your weight. That weight gain might be caused
Mhm.
because of hormonal, could be a sign of cancer. Those 7 signs of predictions of possible cancer, they're there for a reason. Research and time has proven that change in bowel habits, or uh, the, we're taught on our female visits, always do your monthly breast exam. I can tell you from personal experience, healthcare people, in other words, unless you're personally affected, you're not that vigilant. Oh, it can't happen to me, and then you're surprised when you get it and it's already stage 4. um, there are a lot of preventative things you can do and educate yourself. If you know certain things go on in your family, uh, then be more vigilant about that. It doesn't mean you're going to be a diabetic just because Nana was a diabetic. uh, doesn't mean you're going to be on dialysis because grandpop was. It doesn't even mean you're going to be an alcoholic because your grandparents were alcoholics. It might mean, though, that your brain has some genes, the addictive genes, that might get triggered easier than somebody who doesn't have that. So it's important to really, you know, get into yourself and find out. Uh, and but when you reach, when we know what the root cause is, you might still choose to do nothing to fix it, but at least you know why. And
Mhm.
doctors can treat the symptoms, but they're not real good unless it's a psychiatrist, perhaps, of actually finding the root causes. Um,
Yeah. Social
but
workers are great for that sometimes too. Just talking with somebody, something may actually come up, and you're like, oh my gosh, like me with my hoarding food in the house. I found out basically when I was talking to a social worker, and he's like, well, wait a minute. Don't you see the connection here? And I'm like, oh my God, it hit me. I was hoarding
right,
food because I didn't have a lot of food growing up or when I was married and stuff. So it all just was a knee jerk reaction within my psyche. So, which also caused stress. And then it caused physical problems with my immunity from the stress, So now that's gone, thank goodness. But I still have to approach it every now and then to double check.
Right. And when we're looking into and expecting or hoping for a diagnosis, that doesn't resolve you from personal responsibility. Ultimately, there's
Mhm.
help being out there, but your health is your responsibility. And if you have family members that aren't able to take care of themselves, hopefully there's designated people that can help. Um, but a lot of things don't need medication to solve the problem. Uh, there are a lot of options available, different protocols for different issues. It's not a one size fits all business, although insurance companies would love to have it be that way, until they get sick and then they understand. But sometimes I'll be talking to a professional person, but not, a friend who's in like a psychology type background. And I'll say, this just doesn't seem to be working no matter what I do. I can't get beyond this. And well, they say that what's that saying that if you, a definition of an idiot or something is keep doing the same thing over and over. If and your gut has a way of telling you, your mind, your body, when you ask inside, if you're doing something repeatedly, you identify patterns and it's not working, it doesn't mean that you're doomed to do that for the rest of your life. Be open minded and see what, maybe it's something that you saw your mother and grandmother do. So you just assume that's what,
Mhm.
it's part of being alive, it's in your family genes. Uh, there are people that have had autopsies being told they had stage 4 cancer, and they immediately get all of their things in order, and then they die, and there's an autopsy, and there's not a speck of cancer in their body. Examples like that show just
Sad but
how
true.
strong, it's not that they were misdiagnosed. The cancer test even came back positive, but her mind, her psyche was so strong that she basically cured herself. But just in case, she went ahead. Italians are good for hospice patients. If they see the priest, they think they're dying. I've seen people almost getting better, and then the priest shows up, and oh my God, I'm dying, and they die the next day just because they saw the
Mhm.
priest. um,
Yeah.
you know,
That's
so
why,
it's
my pops, when he was dying and he was on hospice, would you like me to call Father Tom? He's right across the street. Let me call Father Tom. No. Okay. Okay. 2 months
I,
later, would you like me to call Father Tom? No. Okay. 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 So it is what it is. But you are
you know,
just, I'm
it
sorry,
just
I had to
shows
chuckle when I heard that.
it, shows the environmental influence, and the cultural influences on our life.
Yeah.
Certain cultures are more prone to different kinds of diseases.
Hmm.
I've had a lot of people from the Asian countries come to our country. All of a sudden, they have stomach cancer. It's a very low cancer in their country, but now they've been, thrown into our diets here in America. We'll be right back, and we'll continue the discussion and just talk about how you can make yourself feel heard and be more effective.
Did you know that your beliefs create your entire reality, but it's the subconscious beliefs that do most of the creating? Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like it was almost instant. Like I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. It feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic. Find your greater happiness. Be well. Be aware. Be magical.
Hi, everybody. Welcome back to why the diagnosis is not the root cause, and how we can achieve health and autonomy, and learn how to be a collaborative member of your healthcare team. Um, for nurses out here who are watching this, this is an important You didn't learn in nursing school. They tell you they're giving you the holistic model, but it's not. It's kind of like Maslow's hierarchy of needs that we're taught. It's not quite based on current reality in our current times. Um, we're not telling you to reject medicine and everything is holistic. And evidence is very important, but it's not even the final answer. There's always more than one way to skin a cat or chicken, whatever it is that the phrase is. I don't like saying cat, but
No, mew mew. No.
uh, you know, but help me out here, Gloria. You know what I'm trying to say here. As far as I
Yes,
want
yes. There's
to,
more than one way to do things, but holistic method, it's just on top of the taught nursing care that a nurse would do. You're also looking for other ideas to do as complementary medicine to add to the patient's comfort and perhaps even investigating and finding out a little bit more about their situation to extend it further. So it's an extension. So a lot of that has to do with listening to patterns, taking the time to talk to the patient because perhaps they have a little more time that they can spend, maybe 15 minutes rather than 5. Asking better questions is always a good thing. And that just means the questions that may pertain to each specific individual. You know, nurses are more at the ground level, so they see a lot of these questions they could ask. um, so how are your kids? Are they driving you crazy yet? Any
yeah.
question can help to get the stress level and whatnot. And I'm sure you know many more than I do, Peggy.
And with pain management, which is a big frustration for a lot of patients across a myriad of diagnoses, uh, especially for serious illnesses, yes, we don't want your life can be more productive if you're not in pain. Obviously, that's the obvious statement. But there are holistic ways of managing pain and managing stress that don't have the side effects that a lot of the medications do. Um, if you're a hospice patient and maybe 50 years ago you had an addiction problem, don't be afraid to let them give you medicine to be comfortable. You're not going to get addicted
Hmm.
again. It's a different time, different place, different body. Really, you're a different person now. Uh, but when you do take a lot of medication, one of the side effects is you might be more tired, too tired to function in some of the activities you like. So if you can learn alternative ways, like we used to put the mother to sleep to have babies. Now then we had Lamaze and we have other yoga for childbirth. And there's different tools that are out there holistically that can
Hmm.
can make you need less traditional medical symptom management. I'm not going to say you need less medical professional care because we need to be monitored. Somebody's got to be running seeing the overall picture. As a nurse, I see a lot of the side effects of things that were missed in the picture, but I don't always know everything that's in the doctor's mind either. But your doctor can't read your mind, and
Hmm.
it's your responsibility. I've had people come home from the doctor and say, I spent 3 hours in the doctor's office and he didn't give me a thing for pain. And I asked what was obvious to me, did you tell the doctor you were having pain? And they looked at me like I was on a different planet. The doctor doesn't read your
Yep.
mind. Um,
Hmm.
and just because all your relatives tell you you're a hypochondriac, just take a deep breath, be honest with your doctor. Say, I've been on this journey for a while. Maybe you can see something that I've missed or other doctors have missed. I really would like
Right.
to feel better and have a more productive life. And nobody wants to be miserable. Nobody wants to not feel good. You know, uh, as we get to my age of the spectrum, you want to be there for your grandchildren. You want to be active grandparents. You don't want them to remember, grandma, my mom's always, asleep, or my mom can't go to the games because she's too tired or having pain, you know. But it doesn't mean ignore your pain. It means find ways of managing it that you can still have a productive life. And that's something that's within the control of most of us. Um,
Yeah.
when you're isolated a lot, and we learn that from all age spans with COVID, you end up looking deeper into yourself and seeing things, maybe hearing voices of sorts, that you're you are the only person you're talking to and you're around, so you're not always the most objective person, and the isolation makes you afraid even to go out and tell people because you don't want to take medical care away from somebody more serious. I've had patients that, well, no, somebody might be having a heart attack. This is no problem. I can wait a little longer. You could feel a lot better sooner if you can, get the root cause. And that's what we try to do with holistic medicine. And it makes doctors' job a lot easier. It saves money on insurance costs. Uh, if your input can help pinpoint what the doctor might be suspecting, he's not going to run $20,000 of tests totally unrelated just because you're a senior citizen and most people your age start having this problem. Uh, that's why it is so important to be a collaborative thing. Um,
Mm-hmm.
and care is more individualized. If your doctors and nurses are burned out because everybody comes and says, "Here I am, wave your wand," it's like Star Trek. Don't you have that medical recorder machine that just scan me and tells me what's wrong? Um, that would be easy, but that still would miss the root causes. It would just tell you what the damage is done by the root cause. And a lot of times, you might have stage 4 cancer, but if you can address the other issues that got you there, you have a lot longer lifespan. Because if you're a diabetic, it doesn't mean that you're going to die young and have a heart attack, end up on dialysis, and go blind. It means you have a chronic issue that you have control over to a large degree, not always completely. Type 1 is a little bit different situation. But if you can learn lifestyle changes and have more water in your life and monitor your sugar. Don't just say, "Oh, my sugar must be high or low." Actually learn how to check it. That's something you do at home. Because maybe you just skip lunch because you were too busy. And, it doesn't mean that you're hypoglycemic. It just means, of course, you haven't had any food in 12 hours. Uh, some of the things we do to ourselves, and I don't want to present that as a negative perspective, but it as a way to know that if you did it to yourself, often you can undo it for yourself. But
Right.
we need professional or at least objective people in our lives that can show us some of the patterns that maybe we're missing because we've been doing it so automatically. Um,
Yeah.
the autonomic nervous system. Why don't you talk a couple minutes about that? How much that affects all areas of our body? Obviously, your autonomic nervous system goes to your gut, your leaky gut, and other things.
It affects everything in your body. Your nervous system is like the brain of your body that just is extends everywhere. Um, the thing about the nervous system, though, it sorry, it really loses its regulation when there's swelling somewhere in the body, and that's a lot of the times the pain is goes to that point or above that point. So when you have a pressure on a nerve, you have problems. You were mentioned chronic pain and inflammation and things. And so let's say the root cause of your problem is the inflammation caused by high cortisol levels or an injury or something. Is an anti-inflammatory diet made up of broccoli and coffee, avocados. There's garlic is an anti-inflammatory too. These foods are always great when you're not feeling well, especially during flu season, because you can take some of that swelling down, then your body can get in there and start to regulate it better. But in order for the nervous system, there you can do things to regulate it again, other than diet. You can have gargling even. It's a vagus nervous stimulation, gargling. Extended exhales, deep breathing, inhaling and counting to 5 and then exhaling, making yourself count to 6. But when you inhale, make sure those lungs are really full, and mindfulness and body scan meditation. When you lay there and you first feel your toes, just your toes, then your feet, and you work your way up. Things that actually help your brain and nervous system relax, because when there's swelling, it needs to relax sometimes so that the circulation can get in there. When nerves are not relaxed, it decreases the circulation to the nerves. And you need to increase that circulation to keep them healthy. So keep that in mind. You can do yoga, qigong. my two favorite. I also meditate. I pray a lot, and that's part of meditation. Posture correction. I don't know if you've noticed it, sitting here every now and then I change my posture. It's just, it helps my body awareness and can help my central nervous system as well with my spine and whatnot. So anti-inflammatory support isn't just about diet though, and Reiki and things. You can hydration, herbal support like turmeric, ginger, boswellia, that is magnesium. Magnesium is very important. It can take down swelling. It was once known as the painkiller better than any others on earth. So now it's debatable, but it's there. Whole foods, omega-3 foods. I like Mediterranean diet. It has a lot of that anti-inflammatory foods with good nutrition, as well as a lot of whole foods. And plus, another thing important though about diet is keeping away from refined sugars. And fructose now, they had found, and research has found a direct correlation between fructose and Alzheimer's. So just a thought, that's in fruit. It's higher sugar in fruit in general, and it's just a lot for your brain to take in at once. There's things
A
for
lot of
emotion.
the old wives' tales that we've heard over from our grandmothers and, go pass on, like an apple a day keeps the doctor away. What is it in that apple that they were trying to tell us? Is it the pectin
Well, it's
or?
hydration. There's some levels
Okay.
of vitamin C, and everyone knows that apple cider vinegar is a
Good
tremendous thing.
detox, right.
Right.
Okay.
So I would rather do a shot of apple cider vinegar every day than eat an apple, because when you eat an apple, you're taking in so much sugar, it's too much for your body to handle all at once. So a half an apple is more of what I would suggest. One other thing though about eating an apple is it takes up the room in your stomach, so you don't eat the heavier foods, which can raise your blood sugar and cause more problems. So, I mean, you may need that sugar if you're going to go farm a field that day. So I'm not
Right.
knocking it. I'm just saying there's a time and a place.
Right. And if you're worried about your weight, you want to cut back maybe on your portions, if you start your meal with a good couple glasses of water, you fill up quicker. And so you might be prone to have smaller portions and, step away from the table. There's a lot of things that can be done that don't cost money and save so much money in, unnecessary, or, you won't need a lot of those expensive tests.
Right.
But just, it's human nature to be judgmental. We judge ourselves all the time. You might have a healthcare practitioner who's having a bad day. They're not supposed to be judgmental when they're talking to you, but everybody's human. Just, listen to yourself and follow your gut, your internal feelings, your instincts. And there are doctors that you might not be going with. So if you're getting anything out of this today, just remember, diagnosis is a label. It's not your identity. And true healing begins when we look below the label and see the body's deeper story. Thank you for joining us today with Dr. Gloria Warren. This is the Holistic Nurse with Peggy Smith. Gloria is on Wednesdays on the Pod Unity Network live
2
at
o'clock
2 o'clock
Eastern.
Central Time. Oh, Eastern Time. I'm sorry.
Yep.
And we'll be back next Thursday. Thank you for joining us today. Have a good week.
This has been The Holistic Nurse with host Peggy Smith. Tune in each week where you're encouraged to send questions and receive private responses and suggestions if appropriate. Thursdays, 1 p.m. Eastern,